Hello, I'm Shelley Fold-Masso, CEO of the National Coalition for Cancer Survivorship. Founded by and for cancer survivors in 1986, NCCS is the voice in Washington, D.C. for survivorship issues. NCCS empowers cancer survivors and advocates to ensure cancer care is the best possible for survivors from their diagnosis onward. Thank you for joining us today to learn about NCCS State of Cancer Survivorship Survey. I'm grateful to have Pam Loeb, Principal of Edge Research, joining me today to present the in-depth findings. I want to thank Bristol Myers Squibb for their support of this survey and for their leadership in cancer survivorship. BMS also supported our first survey, released in 2019, as part of our Elevating Survivorship initiative, which empowers advocates to improve survivorship care at the local level. For our 2020 survey, we wanted to ensure a broad national sample that mirrors the population of cancer survivors in the United States. We found consistent themes from the first NCCS survivorship survey. Cancer survivors face significant challenges both during and after treatment. While the cancer care team effectively addresses many of the physical effects of cancer treatment, survivors report that their care team is not as helpful in addressing other effects of their cancer, including fatigue, anxiety, and depression. Before I turn it over to Pam to walk through the detailed findings, a few housekeeping details. Please use the question and chat box to ask any questions. We'll save questions until the end of Pam's presentation. You can go to the Handouts tab to download the slides and supporting materials. You can access all of the materials related to the survey at our website, canceradvocacy.org/survey20. If you're tweeting during the briefing, tag us. Our Twitter handle is @canceradvocacy. Now I am pleased to turn it over to Pam Loeb, Principal at Edge Research.
Hi, everybody. I'm Pam Loeb at Edge Research, and Shelley, thank you for that introduction. Shelley already spent a couple of minutes talking about the research objectives and questions for the survey. We have been really privileged to work with NCCS on a number of different studies over the last few years. And as Shelley said, this was a survey and qualitative research to really drill down on the cancer patient and survivor journey from a range of perspectives, starting with diagnosis through post-treatment care. Hold on one second. So let me just talk for a moment about the methodology so you have a sense of what you're looking at. We started the study off with a series of qualitative in-depth interviews with cancer patients and survivors, which we conducted back in March of this year. And these were people who had been diagnosed within the last couple of years, so they could really, talk with some strong memory about their experiences. We recruited a mix of ages, races, ethnicities, and income, and we also talked to patients and survivors around the country. And those qualitative discussions really helped us hone in on the questions that we would ask in our follow-up surveys. So we conducted two parallel surveys. The first was a nationwide representative survey of adults with cancer and or survivors. And this was fielded in mid-April through early May, a national sample of 840 participants. And we set quotas to make sure that it was representative of the US cancer population by age, gender, race, ethnicity, and region. And we used a few different data sources to make sure those demographics were accurate. We also oversampled some specific populations so that we could look at them with more statistical reliability, specifically Blacks, Hispanics, low-income cancer patients and survivors, and those over 65 years of age. And at the same time that we were doing this national survey, we also wanted to talk to people who are connected to NCCS. So these are patients and survivors who have opted into communication with NCCS. This was a parallel survey fielded at the same period of time, and we got an additional 479 completes from that survey. And in some cases, we will compare these two patient populations in order to kind of better understand the differences between them and other demographic groups. So whenever you see anything in blue or red, it means statistically significantly higher in blue and lower in red. And that's just a visual cue so you can make sense of some of the data that you're seeing. Throughout the deck, we'll look at the national sample, which is green, and then the NCCS connected sample, which is orange. Again, a visual cue for you to get a sense of the two different groups that you're looking at. Again, the national sample was representative of the US cancer population, but there are some just key demographic differences with the group that is connected to a patient advocacy organization like NCCS. That group tends to be more female, younger, have a higher socioeconomic status. Almost half have a postgraduate degree, over a third have household incomes of over $100,000 a year. The NCCS connected group is more likely to be insured by a private insurance company, and they're a little bit more likely to describe their current physical health as excellent or good. At the same time, they're also more likely to have said that they went through chemotherapy during their cancer treatment. So just some interesting differences between the groups that helps describe some of the differences that we see in their attitudes, values, and experiences with cancer. So let me give you a quick overview of the findings. One of the things that we started off each interview with was just talking to people about their cancer diagnosis and then going through the different stages of their cancer journey. And one of the things that became very clear in our open-ended interviews and bears out in the survey is that most cancer patients nationally default to a doctor knows best mentality, meaning that they really rely on their doctor to choose the best treatment and don't have a huge role in the decision-making process. We also see that majorities are set, at a kind of high level, say that they are or were satisfied with their care. But if you go just a layer deeper, there are cracks in this foundation, and there are specific areas where they don't feel as if their healthcare team has been as helpful as they might be. We also see that those who are more involved in treatment decisions from the get-go tend to have more positive post-treatment experiences. So, bottom line, initial involvement tends to result in better outcomes in post-treatment care. I talked about the national sample of cancer patients and survivors and our NCCS connected group. And they are psychographically different. Patients who are connected to an advocacy group like NCCS tend to have higher expectations of care of their healthcare providers and are just more interested in seeking out a range of different resources to help in their own decision-making and self-advocacy. Shelley talked a moment ago about some of the prominent side effects that people report during and after cancer treatment. Fatigue and mental health issues really come out as the most common. And these are things that very few feel their healthcare providers have been helpful in addressing during treatment, and they're not things that they bring up during post-treatment care. So these are gaps in ongoing care that need to be addressed. We see survivors concerned about a range of issues, from physical health to mental health to financial issues. And again, there's definitely gaps in their concern and the amount of help that they feel like they're getting from the healthcare community. And then last but not least, as we go through this data, you'll see that there are some demographic differences. There are a few key audiences whose post-treatment concerns are significantly greater. Interestingly, younger cancer patients and survivors, Blacks, Hispanics, women, and chemotherapy patients definitely are groups that are more pronounced in a range of different types of concerns during post-treatment. So let's drill down into some of these findings in a little bit more detail. I'll start off with some findings around audience mindset. We asked a series of statements about different phases of people's cancer journey, and you can see the actual question at the bottom of the page. Please think about your mindset and experiences as a cancer patient for each set of statements. Select the statement that describes you the best, or if you're somewhere in the middle. And when it comes to treatment decisions, you can see that by a 3-to-1 margin, cancer patients and survivors nationally rely on their doctor to decide on treatment options and choose the best course of action. 61% say that describes them, versus just 22% who say that they're very involved in researching and deciding on the best treatment options for them. And then another 18% are somewhere in the middle. And this is, as I said, something that we definitely heard in the in-depth interviews, some kind of indicative quotes. You can see here on the slide, I trust my oncologist completely and I go by what he says. He's never tried to pacify me. He told me what I needed to do. Another person said, I contemplated a second opinion, but I felt comfortable with my oncology team right away. And our last participant, I haven't questioned him thus far. So, feeling confident in their doctor to make the right decisions for them. We also had kind of sprinkled in between a few people who were more proactive self-advocates. And some of this has to do with experiences, prior experiences. As this first person said, I have a family history, so I was clued in. I don't just blindly take prescriptions or go into surgery. I ask questions, do what's best for you. You know your body the best. And then at the bottom of the page, you can see a cancer survivor who said, I learned that I have to advocate for myself. They know I want them to coordinate, especially when it comes to my depression and weight. I ask questions. I don't just settle for one opinion anymore. So this was a mindset that evolved over time based on experiences during the journey. We also see some differences in mindset by audience. Those groups who are more likely to rely on their doctor tend to be older, male, lower income, Caucasian, and have Medicare or Medicaid, whereas those who tend to be a little bit more involved in their decision making, although still in no case a majority, 18 to 39-year-olds, those with prostate cancer, those who had targeted drug therapy, people who participate in clinical trials, and those who have disability insurance, which does correlate with age because they are employed. And then what was also really interesting was to kind of look at these two different mindsets and cross-tab that with other aspects of the cancer journey. So on the left, you can see the data among patients who report being involved in treatment decisions from the get-go, and on the right, responses among patients who report relying on their doctor. And there are statistically significant differences on how well prepared they felt for post-treatment, how proactive they were in talking to their healthcare professional about post-treatment care, and those who were involved in initial decisions were also more likely to describe their post-treatment medical care as excellent. So I think that's just, kind of an interesting difference. We went on to ask some additional statements about people's cancer journey. And patients, even though many rely on their doctor to make treatment decisions, we had 63% of patients who said that they found out all they could about their diagnosis and their treatment options, although ultimately they allowed their doctor to make the decision. Just 1 in 10 who said, I didn't want to read or think about cancer and hear all of the bad things. So those people are out there, but not a large number. And then we have about half of people who said, I took advantage of any help or resource my healthcare team offered me to help me through my cancer journey, versus a quarter who said I was really self-reliant without a lot of help from healthcare providers, and then another quarter who are somewhere in between. And just kind of focusing on this last statement that I mentioned. We had some hypotheses going into the survey that we might see some demographic differences between those who took advantage of support and those who did not. And honestly, that did not bear out in the survey data. There's really no difference by gender, age, race, income, nor education. And kind of going back to the in-depth interviews and looking at some of the feedback, we had some people who really took advantage of nurse navigators and social workers to help get them information, set up appointments, transportation, versus people who said, I don't have any outside help, like social workers or caseworkers. I have no help except my oncologist introducing me to this chemo. And I think one of the things that this suggests is that this is really not about demographics, but really more about what people are comfortable asking for and relying on, and that not every patient is willing to be a self-advocate, and not every patient is willing to accept support. And then last but not least, in this mindset section, I did want to just share the findings from the survey among those who are connected with NCCS. So those who have opted into communications with National Coalition for Cancer Survivorship were actually really divided on this question. We had about a third who said that they relied on their doctor to decide on treatment options and choose the best course of action. A third who said that they were very involved in researching and decision making, and then a third who are somewhere in the middle. And this, I think, just kind of points to the fact that some people who get involved in patient advocacy organizations are self-advocates from the get-go. Some become more involved and aware over time, and we have some who are in between. So let's move on to look at people's treatment experiences, kind of the next stage in the cancer journey. And I think the good news is that most cancer patients nationally believe that their healthcare providers are doing a good job of coordinating care with one another. So 9 out of 10 of our national audience felt as if their healthcare providers coordinated care either very or somewhat well. That drops to about 80% among our NCCS connected group. And we see here and other pieces of data that they are a little bit more critical, have higher expectations of healthcare professionals, but still both groups pretty satisfied with coordination of care at a high level. When we drill down on some specific healthcare providers, on the left you see the percentage, on the left, you see the, on the left, you see the percentage who say that they've seen each of the following healthcare providers during treatment. And then among them, on the right, you see the percentage who say each group was very helpful. And, most saw an oncologist, found that oncologist to be very helpful during the process. About anywhere from half to 60% saw primary care physician. Again, majorities feel as if they're very helpful, although there are some differences between our national sample and our NCCS connected sample. And then as we kind of go down the list here, we see that fewer regularly saw a nurse practitioner or nurse, care coordinator, patient navigator, but majorities are pretty pleased with their experiences. And then we get into some of the other healthcare professionals who far fewer saw, like social workers, psychologists, rehab specialists, or occupational therapists. We also wanted to understand participation, attitudes, and values around clinical trials, and asked a couple of questions about that. As we know, there's not a tremendous number of people who participate in clinical trials. 9% of our national sample say that they participated at some point in time. 19% among the NCCS group, higher among immunotherapy patients, younger patients, and with the national sample, African Americans. And when we probed in our interviews about why more people don't participate, I think we hear some of the themes that come out again and again in research, in marketing research. This first person said, I was told of one right before the last surgery. I didn't do it. I wanted to try chemo. I was afraid of being a guinea pig. What if something didn't work and I got my hopes up? I was also scared it would produce more tumors. And as you kind of read through these, kind of fear of the unknown, worried that they'll be given a placebo. So just a lot of fear and misinformation. We also asked a number of questions around side effects, and these were asked of everybody in the survey, and specifically, have you experienced this during or following your treatment? And of the 19 different specific side effects that we asked about, the top 12 are shown here, and this is the percentage who say that they experienced each. We only had about 11 who didn't choose any of the 19, and that was mostly among people with stage 1 cancer. But about half say that they are or felt overly tired. About a third experienced depression or anxiety. A quarter loss of appetite or taste, muscle or joint pain, nausea, vomiting or diarrhea, neuropathy, weight loss. And then similar numbers, sexual concerns and or uncertainty about their status. When we layer on some of the demographics, you can see that there are definitely some groups who are more likely to experience a number of different symptoms. And again, blue is statistically significantly higher, red is statistically significantly lower. You can see here that women, Hispanics, lower income patients, and those who went through chemotherapy are more likely to say that they experienced a number of different symptoms. One of the things that struck us as interesting in this study was the fact that those in that 65 plus group were less likely to say that they experienced a number of different symptoms. And when we dug into the data, I think part of it has to just do with demographics. This group was more likely to include people who reported being stage 1 cancer patients, and also fewer in this group versus some of the younger groups who had undergone chemotherapy. Now we get into some of the data that we collected around information sharing. And specifically, we asked our respondents how informed they felt about the side effects that I just showed you. 6 out of 10 nationally felt very informed. That number drops to 39% among our NCCS connected group, which is curious because when we go ahead and we ask specifically about the kind of information that they might have received, our NCCS connected group feels less informed overall, but are as or more likely to have received information in a variety of ways. And I think this just kind of speaks to the fact that they expect more information than the general cancer population. So most people said that they talked about side effects with their healthcare providers, but far fewer said that they got written information, supplies, were referred to a website to learn more, saw a video, etc. And then when we go a layer deeper and we drill down on each of these different side effects, and to the left you can again see the percentage who say they experienced each. When we ask those who experienced each how helpful their healthcare team was in addressing each of these specific side effects, about half felt like their healthcare team was helpful in addressing nausea, vomiting, diarrhea, skin irritation, and dermatological problems. But only a quarter to a third felt like their healthcare team was very helpful in addressing any of the other side effects, including those that were most prevalent. And to just kind of highlight this, we pulled out a quote from our in-depth interviews. As this woman said, "What bothered me, you have heavy doses of chemo which affect your body, but no one says it will affect your brain. When I mentioned this to my oncologist that I was depressed and anxious and I had a knot in my stomach and I was shaking, he'd say, this is very normal. It will go away." So now let's talk about the transition to post-treatment care. And I think the good news is that, again, we've got about half who feel like they were very prepared for post-treatment care. Interestingly, that group skews older, and also those who have not gone through chemo. And I think, just looking back on our interviews, the older 65 plus population just more likely to have friends and family members who have gone through the cancer journey, have a little bit more information, and also just kind of generational differences on what being very prepared means. So younger patients, those in later stages, and those who have had chemo are just less confident in how well prepared they are for post-treatment. In terms of the type of information that people have discussed with their healthcare providers, 6 out of 10 said they talked about what to expect in the post-treatment phase, but far fewer said that they discussed exercise and nutrition, long-term side effects, information about who should manage their post-treatment care, information about emotional or psychological services and support. Only a quarter discussed that or received information about that from their doctor. And then just 17% of those nationally said that they received a post-treatment survivorship plan or next step summary. That is 11 points higher among the NCCS connected group. When it comes to who cancer patients nationally rely on for post-treatment information and support, again, the green bars represent the national sample, the orange bars represent the NCCS connected sample. Both groups definitely rely on their oncologist, but our NCCS connected group also looks to online sources, support groups, and patient advocacy organizations for information. And most people report that their primary care provider or their oncologist is handling their post-treatment care, and that they're going to checkups either a few times a year or annually. At those checkups, about half are talking about their physical function and their quality of life, but only a quarter are discussing their mental and emotional impact of their illness and how much fatigue is interfering with their daily life. And I just point that out because those were the two most common side effects that people say they experience either during treatment or post-treatment. And I think interestingly, there are some gender and generational differences. Men and older cancer patients are less likely to talk about anxiety, depression, and fatigue with their doctor. The last section of the study is around survivorship needs. And we asked our sample about 25 issues, range of physical, emotional, and financial issues, and how concerned they are with each personally. And at the top of the list are maintaining a healthy weight, getting enough exercise, being there for friends and family, the cost of medical care, and having the energy to make it through the day. So these are kind of the top concerns across the board. When we look at all of the different concerns that we asked about in the survey, and we break them out again by different demographic groups, I know there's a ton of data on this slide, but really what you need to pay attention to is the numbers in blue and the numbers in red. And it's important to note that Blacks, Hispanics, 18 to 39-year-olds, women, and those who have gone through chemotherapy are more concerned about a range of physical, emotional, and financial issues. And then those in lower income brackets are specifically concerned about issues related to their finances, having financial support, the cost of non-medical expenses, keeping their health insurance, the cost of professional caregiving, loss of income, and how to get help applying for grants to help with costs. On the next couple of slides, we'll look at those top concerns, which we represent with the line at the top of the page. So this is the same data that I just showed you on the previous two slides. It's how concerned cancer patients nationally are with each of the following issues. And then at the bottom of the page, we have the percentage who say their healthcare team has been helpful in monitoring each of these issues. And you can see that there's gaps on all of them, from physical issues like maintaining weight and getting enough exercise, to mental issues like being there for family and friends and uncertainty about the future, to financial issues around the cost of care, prescriptions, and non-medical expenses. And these gaps are even greater with our NCCS connected group. And again, I think, part of that has to do with the fact that this is a group who is more informed and thus has higher expectations, and or potentially has gotten involved with a patient advocacy organization because they've needed to. They've had experiences that have led them there. So I will end this presentation with just a few quotes that we share from the in-depth interviews. And at the end of each interview, we asked our participants to give advice to other cancer patients and survivors, summarize what they learned. And I think that these are, pretty indicative of the findings of this study. So, we definitely had some people who just kind of reiterated that doctor knows best mentality, trust the process and listen, just continue to move forward and get it out of the way. It's the best way to approach it. We also had advice from patients who are more likely to be self-advocates, pick doctors who will spend time with you and answer your questions, find someone who's willing, who's understanding and willing to listen. A lot of people describe this as a job that you just push through. You make a checklist, you celebrate each victory. You've got to focus on the end point and take control of what you can and let go of what you can't. And definitely people, very low expectations of what the experience will be like. We also had people who talked about getting on top of side effects so that there were not the same gaps with them in the care that they had experienced. Stuff they didn't tell me during treatment to help with nausea, sores, muscle pain. I couldn't lift my head. I wasn't prepared. Tell patients that it's normal to have anxiety and depression after chemo. And then this last quote was from a 39-year-old mother of three who, I think I shared a quote from her on a previous slide, who really was kind of going at it alone and struggling. I would tell them to keep your faith because you need that. Think about your outcome. I would tell them to fight as hard as you can and prepare yourself for the biggest fight of your life. It feels like your body betrayed you, so now you have to fight. Cancer is not going to overcome you. And, obviously, you can hear resilience in this, but you can also hear some of the guilt and the fear that this woman experienced. And, I will just kind of end with, something that Shelley has said to us as we shared these findings that really struck with me, which is that we don't make it a priority on how to live with cancer. And I know that is really, the mission of this organization and of those of you on the line. So with that, I will end the presentation, and I'll stop sharing my screen, and Shelley, if you want to get on as well.
Yes, I am on now, and I have a few questions that have come in from the audience and a few of my own as well. Just a reminder, if you have questions, you can, there's a question and chat box, you can enter your question, and we will try to get to as many as we can. But before I get to some of the questions that have come in, I just want to ask you, Pam, what surprised you the most about the findings? Because I know you've done, well, first of all, I want to say thank you to you and your whole team at Edge Research. We have loved working with you. This is our third project to work with you all on in the last 5 years or so. And I just think your, relentless focus on getting quality data that really captures the patient experience is really incredibly helpful to us. And we've gotten so much out of it that's really helped, our previous survey really helped drive some of the things that we do and some of our advocacy efforts. And I think this one will as well. So we're grateful to you and your whole team. But I know that you also do research with other groups on patient mindset and patient issues. So given that, what was most surprising to you out of everything that you saw in this, and both between the interviews and the survey?
I think probably there were two things that were really surprising to me. And, obviously I'm a market researcher and I look at, audience differences. One was the age differences and just how much younger cancer patients are struggling. I think we don't think about younger cancer patients as much because it's not as prevalent. But this is a group that definitely needs help. Even though they are more likely to seek out resources from a number of different channels. And then the other thing I think that surprised me was not seeing any demographic differences around getting as much support from your healthcare team as was offered. And then that is really something that's driven more by personality than by, being educated or, the type of insurance you have. The type of care that you receive. So those were the two things that stood out the most for me personally. What about for you, Shelley? What stood out the most for you?
Well, I think, we've talked about this a lot, and that the kind of, what you said about there's no real demographic of a patient who's an empowered, activated patient. And it just like this, it's the psychographic thing. It's when you're faced with this difficult diagnosis, some people's mindset is to get into action, to get as involved as they can, to do the research, to really be involved in their care, and some are not. And so all of our efforts to educate and empower patients are incredibly important for that. Not insubstantial, I mean, more than 50%, but not as high as 60% in any of those demographics of the people that really wanted to be engaged and empowered. But my concern is making sure that at the same time we're educating and empowering those patients, we're also advocating for a system that works for the large group of patients who are not able to or interested in being self-advocates. And frankly, you shouldn't have to be a self-advocate to get good cancer care. We should make sure that you're getting good cancer care regardless of whether you want to. You shouldn't have to do that in order to get the right care. And so I think that, it just highlighted for me that, we have to keep doing both things, both the education and empowering patients, but also the advocating for system change to make sure that everybody has access to good care, even if they're not a self-advocate. And I think that's something that really, I think, hit home to me.
Got it.
Pam, another thing that I thought was interesting, one of the reasons that we went to a national sample this year, because our previous sample and in our survey that we released last year, it was NCCS recruited about 60% of the 1,400 or so respondents, and then a number of our partner advocacy organizations helped recruit patients as well. So we had a wide variety of different types of cancer. But, they were still all connected in some way to a cancer group, and that's how they learned about it. And as a result, we didn't have as many in the over 65 age range, which is obviously a huge percentage of the people with cancer. And so that was one of the many, there were several reasons why we wanted to recruit a national sample, but one of them was to make sure that we had representation of the Medicare age population. And I noticed when you showed the concerns that that over 65 were below, statistically significantly lower in every single measure. What do you make of that?
I think part of it is that that group is just more diverse in terms of this stage, cancer stage. We have far more stage 1 cancer patients in that cohort than the younger cohorts. And I think the other part of it is that they are more mixed in terms of having undergone chemotherapy. So, if you've had chemo, you're more likely to have experienced a number of side effects and be concerned about a range of issues. And then last but not least, I think there's just generational differences and the way that people think about and express themselves. And I know, Shelley, we talked about that on one of our calls. That's not something that we've really drilled down on in our research, kind of the generational differences in how people think about healthcare. But that is, that's obviously something that's been studied and that we see in lots of different studies.
Yeah, and I think that every time we do this, we're getting a lot of great data, but it's also raising a lot of questions that we might want to ask next year. So, actually that leads me to a couple of the questions we've gotten from some of our audience members. One said that the list of side effects is impressive, but the questioner asked if we included any measures of positive side effects, such as being motivated or inspired due to a cancer diagnosis. I don't believe we did, but I want to confirm that with you, and then maybe that's something we might consider in the future.
Yeah, no, we did not. We didn't ask about any positive side effects, but that's probably always a good thing to talk about the positive. I mean, we did hear about it though in our in-depth interviews. We had people who, certainly would never want to go through this again, but did talk about, life skills that they had built up because of their cancer journey. Friendships they had made that they'll have for the rest of their lives, and positive relationships that they had with healthcare providers that they'll always be grateful for and never forget.
Yeah. And then another question was asking if we asked about spiritual needs or differences among survivors of different religions. I don't believe we asked that either, but I wanted to confirm.
No, we did not ask that, but that is a really interesting question to study moving forward. I'm writing that one down. Should you decide to do another study in the near future?
I hope that we will next year. This question seems like a well-structured survey. Can you report on representation of survey participants according to cancer diagnoses? I don't know if we didn't break anything down by diagnosis, did we? Or do we have enough data in each diagnosis type to really have any statistical significance there? Or
yeah, we do. It wasn't a focus of the analysis. We definitely looked at the statistics around different types of diagnosis, and we we made sure that the survey was representative. I don't think we weighted the data on that specifically. We just kind of we did weight the data on a couple of other measures where it didn't come in exactly representative, but not on cancer diagnosis.
Okay, another question. Did the metastatic patients have issues that really stood out compared to those that did not have advanced disease?
You know what, that is something that I do not have my crosstabs up right now just because it's really hard to share a PowerPoint, but that is something that we can definitely follow up on. That would be easy to look up. So we could do that offline.
Yeah, there may be some questions that we don't have the answer to because it's not how we, sliced and diced the data, but we could go back and answer some of those, so we can post those on our website in the coming days. It's at canceradvocacy.org/survey20. So let me see. There was one question about, did you ask about cancer survivorship plans and who received one? And I do remember that because it was a very low number. 17% said they received a cancer survivorship plan.
Right.
So that just shows we have a lot of work to do.
Right. Definitely higher with those who are connected with you, 28%, but still not a majority.
No. And we also, we can report, I don't know if your demographic slide had the different cancer types. Was that there, or do we have that?
I'm looking to see if I have that data. You know, I would say that the top 3 cancer types included in the sample were breast cancer, prostate cancer, and skin cancer. So about 27% of the national sample were people who have had breast cancer, 19% prostate, 15% skin. I don't have the other numbers in front of me right now. And then some people have had multiple types of cancer.
Okay. Okay. Did we explore why patients or their caregivers did not seek supportive resources that were available to them? That would be, it's not in the survey, but I don't know if you got a sense of that from the in-depth interviews that you did.
I mean, honestly, it was just, a lot of it just had to do with the personality of the patient. I mean, some patients are just, I was kind of shocked, particularly because we interviewed some patients who were just struggling so much. I mean, their situations were, in some cases, horrible. And I got off the phone and I had to have a little cry. But a lot of it just had to do with, not that the resources weren't there, but either not trusting other people and healthcare providers to help, feeling like the help that was offered was substandard in some cases, with some Medicaid patients specifically, and or just being fiercely independent and just feeling as if you just gotta, kind of suffer through on your own. And in some cases, you just wanted to give them a, stop, but I'm an objective question asker for hire, so I just listen.
Yeah. There are a lot of questions here that I'm not going to get to all of them, and some of them are definitely areas that we did not delve into, like the effects of, one question is about oral side effects, and we didn't get into that level of granularity. I think some of these we'll take into consideration for our next survey next year. Another question was about whether we explore the unique needs of cancer survivors who have housing insecurities or maybe homeless. That's not something we delved into specifically in this survey. And then also, have we looked at the data geographically? I don't know that we broke it down that way, but
we did look at geographic differences. There were not huge ones, which is why we just didn't report on them, at least on the questions that we asked about. So we do have geographic data though in our crosstab. So if anybody has any specific questions, that's information we can easily provide.
Great. So on a slide about survey participants, there was a big difference between female and male who are involved with NCCS. Is there a reason why this might be? That's definitely something that we've been thinking a lot about, especially because, when we saw that, what a high percentage of the NCCS connected respondents were female. And it is, you didn't see differences really in terms of engagement or self-advocacy among men compared to women, did you? I mean, although maybe there's that difference between self-advocacy and then advocacy for others, like being involved with an advocacy organization. It's definitely something we're looking at, and we had a session at our symposium back in June where we were talking with some of our male advocates about what do we need to do to get more men involved in advocacy. Because it is, for us at least, the vast majority of our advocates are women, and we'd like to engage more men in advocacy. But can you comment on the self-advocacy piece, if there were differences among men?
The one place where we did see differences was on that first question about how involved people were in the treatment decision. And actually, men are more likely, and this was also a little surprising to me, men are more likely to say that they just kind of default to that doctor knows best mentality and let the doctor make the decision rather than get involved in researching and participating in the decision making on their treatment.
Mm-hmm. I'm not sure if we have enough data for this, but you might have gotten some of this out of your in-person interviews or the in-depth interviews. That this was from someone asking if we have any advice for cancer centers who employ navigators, social workers, and dietitians, how to better engage people to accept or access these services when offered. We really didn't ask why they're not accepting it, but that may have come across in the interviews.
I mean, again, some of it was generational. Some of the older people that we interviewed, at least with mental health care professionals, kind of a stigma related to mental health more than with younger patients. Some of it was just trust. And some of it was also just awareness, not being aware that there are these people that are there for them. That's all I can really gauge. But that I do think that is a really interesting area to explore in the future. Just, kind of non-physician healthcare providers and, kind of better understanding how to increase engagement with those individuals, because we do know that people who sought support, who received support tended to feel better, about their kind of post-treatment experience.
It may also mean or require that you offer it multiple times. When you have cancer and you hear that diagnosis, there's a lot of information thrown at you, but that doesn't mean you're retaining it. And so if, we were talking with one of our Elevating Survivorship ambassadors recently, who's an incredibly activated patient and engaged advocate. And she learned about just recently, and she's many years out from her treatment, just recently learned about some navigation services offered at her cancer center from her doctor that she never knew existed. So, it may just be a matter of communicating it to people who maybe aren't hearing it when you offer it at the time that they're making treatment decisions. So maybe it has to be, you have to continue following up and making sure they know about the services that are available.
Yeah.
So another question is about, as the boomer population ages, will the generational differences become less?
I think that's always like the $1 million question. Like, is this a life cycle thing, or is this really a generational difference? And only time will tell. My guess is yes, probably, just because the boomer mindset is different.
Yeah. Right. There's several questions about, and I already mentioned one about issues facing people with metastatic disease, but also noting the fact that people with metastatic disease often live for a long time. And I think that there's more and more effort being placed on metastatic survivorship. It's something we talked about at our symposium in June, and we'll continue to do. One of our Elevating Survivorship ambassadors is working on that as her project to really try to provide better resources for people with metastatic cancer about survivorship needs. Another comment is on the focus on the need for a healthy lifestyle is an important finding. I was a little bit surprised by the top two concerns being about weight and exercise. I think that's a positive that people understand that that those are important to survivorship, both reducing risk of recurrence and overall quality of life, but also speaks to the fact that they need help with it. And so I thought that was a really interesting finding as well.
Yeah, that's probably something we should have highlighted a little bit more. Yeah.
I'm just looking through the questions. I'm sorry that we're not going to get to all of them, but we definitely have a lot of questions, so thank you. So this is a good question. You have presented great data regarding symptoms like fatigue, mood, et cetera. Do you have any statistics on how cancer impacted functional independence or ability to perform self-care, daily routines, or instrumental activities of daily living? So we did ask some questions about functional status because we completed a project last year where we worked with a group of cancer survivors to really define some quality measures around functional status. And part of that was one of the things we heard from our committee of advocates that we worked with is that no one's asking us these questions. No one's asking us about our functional status. So when these concerns, like some of these quality of life concerns about fatigue, depression, anxiety, but some of the others about daily living, if no one's asking, then no one's offering any help addressing some of these issues. So part of what our advocates said we needed to include in this quality measurement is a quality measure on whether you're being asked about these elements of your functional status, and then if so, whether anybody's offering you any assistance in addressing them. So we did ask some questions about that in the survey, really to help kind of confirm what we were hearing from patients is that they're not routinely asked these. And we didn't include it in this presentation because we had so much to include and wanted to, but I don't know if you could speak at a high level to any of what we heard on the functional status questions, Pam?
Yeah, and I think I actually did share the slide. We had about half of people who said that they talked about their physical function and their quality of life with their healthcare provider during post-treatment care. We had far fewer, just about a quarter, who said that they talked about their mental and emotional impact of their illness and how much fatigue is interfering with their daily life, as well as if pain is interfering with their daily life, and really hardly anyone who's discussing their cognitive function. So yeah, so that was some of the data around those specific questions.
Okay. This was a suggestion of, would you consider doing a study with early stage survivors and one with patients in treatment or survivors of advanced stage cancers? I think that we could potentially, I think we have all of those types of patients in this survey. We just didn't break it down that way, but I think we could analyze that more in depth with this data, and then also in previous or in the subsequent study. Oh, and I just realized that we are at 2 o'clock. I'm going through the questions because there's so many good questions. I was hoping we would get to them, but I don't think we're going to be able to get to all of them. But I want to thank you, Pam, and again, thank your team at Edge for such an incredible job on this survey and helping us really understand what we learned. We'll try to answer some of these additional questions that we didn't get to and post a Q&A on our website in the next week or so. I want to thank all of the team at NCCS for making this webinar briefing today possible. I know a lot of hard work went into it. And again, thanks to our supporters at Bristol Myers Squibb for helping us to be able to do this survey in the first place. And we really appreciate your attendance today, your incredible questions, and some great suggestions for our next survey. And we hope to be able to present that to you next year. So thank you all very much for participating, and thank you, Pam.
Thank you.